Hey guys, it's Dr. Greer. I have not done a good long video lately about laser treatment. So let's talk lasers. Lasers are amazing. They do lots of different things. It's basically a tool to achieve different goals. And there's two types. There's ablative, which means we're burning things away, like it's actually vaporizing the skin. And then there's non-ablative, which doesn't vaporize or destroy the skin. The non-ablative treatments tend to be, Moxie would be one, that's by Cyton. And then the deeper wavelength of Halo, it's actually doing injury deep below the skin surface, so you don't get damage on the surface of the skin. But Halo has two wavelengths, so there is a wavelength that damages the surface of the skin to achieve something else. And then BBL or IPL. So broadband light or intense pulse light are not technically truly lasers. I'm not going to get into the physics of it, but basically we're applying different filters to very bright light to pull out different wavelengths. Some other wavelengths still kind of spill through, so you have to be very cautious in how you use BBL. There's a little bit higher risk of causing injury to the skin in darker pigmented skin types. So it's a different type of technology, but we usually throw it under laser treatments. The treatments we offer at my office, it's Forever Young BBL is the one we do most of. That's non-ablative, and that will get all those little spider veins you get around your nose, around your cheeks. It'll pull out pigmented spots, and it will build collagen. It's not ablative, so there's no healing time. You may have some redness. If you have any larger spider veins, you may have some small bruises. And pigment will get darker. It's actually pulled to the surface of the skin and then it flakes off, but you don't peel. And you can wear makeup right away. And Elise is just leaving something on my desk, don't mind her. And that's our non-ablative treatment, the Forever Young BBL. So that mostly corrects pigment. If you want texture correction, then you're looking at resurfacing. That's the ablative. There are two different types there. There's fractionated versus full field. Fractionated, think of that as like aerating a lawn where you're poking little holes in it, and you can do a deeper injury because there's lots of healthy skin cells in between to heal. Full field, it's more like mowing the lawn. You're taking the entire surface down a few microns deep or 600 microns deep. It depends on what depth you go. But because you're destroying the entire surface of the skin, you can't go too deep because you need healthy cells down deep to help things heal. And again, these are just different tools. The more aggressive we get with the ablative, the more impressive results we can give you in terms of smoothing out wrinkles and improving laxity, but you're going to have more downtime because it takes longer to heal. When people start worrying about like Fraxel versus Pixel versus, they're just brand names for different things. Really, it's like, are we doing full field resurfacing or are we doing a fractionated where it's a pixelated pattern? Is it ablative or is it non-ablative? So I don't expect you to like listen to this TikTok and say, what do I need? That's really not your job. That's my job. So go see a plastic surgeon or dermatologist near you who has several different lasers, so they're not a one-trick pony. We have the Cyton Jewel, which has different modules. I love it. Like, they just plug in, we change the handpiece, it does different things. And tell them what your concerns are. So if it's red spots, if it's spider veins, if it's pigmentation versus texture, you may need to combine different modalities to treat all of those things. And that's why laser stuff is so complicated. It's basically like an artist having multiple different tools and just knowing what you need. Now, when people ask about the difference between laser versus chemical peels, we're just stimulating injury a different way. Chemicals burn off the surface of your skin in a different way than lasers do. I like the laser because it's super predictable. Chemical peels are really nice if you're doing lighter peels. But if you want anything deep, then I love the predictability of the laser. So questions about laser treatments, leave them in the comments and I will answer you.